last session, I had the opportunity to sit down with Dr. Monica Walker and to talk about a very interesting topic, drug slavery. And we promised we'd have a lot more on drug slavery during this session. So joining me live again is Dr. Monica Walker. Dr. Walker, thank you so much for being here. Let's talk about drug slavery. What is drug slavery?
Well, first, thank you for having this series, and thank the T. Laura Jefferson Medical Society for what they're doing to enlighten our community, and it's my pleasure to be here. So what is slavery? Slavery is when one person or a group of people are indebted or in bondage to another group or an individual, all for economic privilege. And so for drug slavery, we look at what's going on with our community, how it started, when it started, and why it started.
So take us back to when it started.
So in the 1900s, we looked at opium. And opium was outlawed by the federal government in the early 1900s. And we know that that included heroin and opium. There was a large opium trade from the East. And I guess we don't have time to get into all that history. It is actually not important for us to understand what drug slavery is now in 2021. So even though it has a long, long history, not much has changed. It's all about the exchange of money, how money is used, why people are used to generate money for another group of people.
Why do you think in the black community this drug slavery is so prevalent?
In the African American community, if we go back to President, let's say Richard Nixon, we can look at Reagan, we can look at what was the slogan that Reagan's wife, Nancy Reagan, had? Just say no. No to drugs. And that was popular because it was thought that it was the weakness of an individual to get addicted to a substance. So instead of that addiction being treated like a disease, a disorder, something that we as physicians can help a community and try and show them how this addiction does not have to overcome them and destroy their lives and the lives of their family, we treated them as if they were criminals. Now, fast forward to the opioid crisis that we have now. The opioid crisis that we have now, largely European Americans, young, who are not treated like criminals. They are not arrested, incarcerated, and imprisoned for many years, but they're told, you're sick. You need to go to a rehab center. In the American Medical Association, we have ICD codes. What is that? An ICD code gives us a diagnosis. And so with that diagnosis, we can say that this person has a substance, and we have different names for them, but there are lists of names that we can say, this is the problem. It is not the individual, they're sick. That's what an ICD code says. You are sick. A CPT code says, not only are you sick, but we have now a code that we can use to treat you. So we look at it now as a sickness, and we can treat you. We will not incarcerate you. So that is the difference between what happened to our community, African American community, and the European community now.
Wael Paul is living a life of recovery. He's been behind bars. It's what's turned him around.
I still have the same sponsor. I'm still doing steps, doing service, being involved. What the greatest gift is like now, it's not so much to focus on the drugs, but how the addiction affects my life and the thinking that may happen at times that takes me way to the left or right of something. So it's about trying to learn to stay centered, so when things come up, I have a source to go to bounce things by, to, look at the place that this is coming from in terms of thoughts. By step work again, communication with a sponsor and support team that's around me.
Now he works to help others find their way. You are literally on the front line of addiction by working at the call center. How do you reach out to people?
Okay, so I'm in a call center and I work overnight. So some of the calls I'm getting are family members that don't understand like what their family member is going through. You know what I'm saying? So what I'm able to do is to provide them some information and a little comfort. Some of them call in not understanding about what it is their family member is going to be getting help with in terms of treatment, what is detox. So explaining to them, you know, what we have there, which is 24-hour nursing care, a doctor, a psychiatrist, that they will be getting medication, that they will be, you know, going to groups, you know, and breaking down the different types of group individual therapy while they're in there. But the main focus is to get them healthy so that they could stop for a moment going through what they're going through. So a lot of people want that comfort because they're maybe ashamed to talk to their friends or they don't know who knows. So a lot of the times it's also being patient with individuals who have no idea about this disease. So, you know, it works out both ways. It's like I'm there to help somebody get in, and then I'm helping other people with just the comfort of knowing that, you know, this is going to be a good decision for their family member.
He helps people like Darren, who we met in our last series. What would you say to Darren if he were here right now?
I would say there's a way out. We just need to be patient, and he needs to be patient with himself and not to beat himself up, to understand that a lot of things that he was doing and have been going through is the disease. That wasn't him. But that if he could just stay still long enough, get clean long enough to allow the obsession to be removed, that he has a shot. And that there are people out here that will help him, that have been through that he's not alone. He's been in different facilities, he gets it. He probably has been in 12-step program and he gets it, but you have to want this. This isn't just about people who need this, because here's a lot of people who need it, but you have to want this, and then that wanting means you're willing to do the work that's required to keep yourself daily on not getting high. So you have to be willing to do that, and that's what I would say to him, that it takes work, but it's worth it. The reward is great to be clean.
The concept of drug slavery. Do you agree with that?
I think we all become slaves by the drugs, you know. I believe that once you start to pick up and it takes over your life, you're becoming a slave to it. It will tell us when to get up, what to do, how to do it, how to go get it. You know what I'm saying? We stop being an individual and become a part of an army that is suffering. Yeah. I can see where that would have some merit. I think that it's kind of like triage. You know, they're only doing but so much. You know, and then when you have the incarceration that is happening through people going out to seek ways and means to get one more, which then means crime may be committed. So from that happening, you know, the system is more focused on locking us up than actually doing some type of curative versus, you know, preventive. Because preventive means that they're looking at, hey, what can we do to help these people before we lock them up? What are the resources that we're making sure that's available? Because truthfully, you know, treatment facilities are geared around really making money. That's just my opinion of it. You know what I'm saying? They are there. They're helping. Yes, there are people that are really diligent at what they do. But the idea is, how do we continue outside of that? What is the things that are being provided, the resources that are being available to someone that has gotten locked up based on drug use, so that when they're released, they have an avenue to go to rather than return to the place that got them locked up from the beginning? Because when we go back to our environments, the environments haven't changed. The environment hasn't changed. The drugs are still there. So we're going to be subjected to the same thing that got us locked up in the first place.
Let's talk about the statistics in the prison right now in terms of white and black.
So the overwhelming majority of people in prisons all over this country, federal, state prisons, detention centers, are African American and overwhelmingly African American males. Let's take an example. In North Carolina, African Americans make up 10% of the population, the general population. They make up 60% of the prison population. The reason for that is obvious. We have a group of people who are used as slaves by whichever means necessary, accused of a crime, go through the criminal justice system, given prison time above and beyond most other people, and now they become a part of that merchandising, which is called the prison industrial complex.
What needs to be done in order to level the playing field so that the African American community, black and brown people, can get the treatment that they need and be treated the same way?
Let's go back a little bit. The reason I say let's go back a little bit is because laws were enacted after certain things happened. For instance, I'll just use one landmark death that everyone in this country remembers. That's when Len Bias died. He was about to be traded, great athlete, used crack cocaine, and died after that. So after that, laws were enacted for the use and the selling, trafficking of drugs. And for that, we see that now the laws are still in place. So the laws are wrong. The laws come against our community. So when you have a person who goes before the judge, and the judge is biased, and we know many judges are biased, of course. I mean, that's not anything that startles us. We're not astonished by that. We know that that's true. So that the number of years that they get for what's called a crime, well, now let's compare that to someone who is also using drugs, something that's an illegal substance, but instead of getting years in prison, they're getting a few months in rehab. And if you relapse, it's okay. You go back to rehab. So now you see the dichotomy between those who are treated as criminals and then therefore put into a system where they're told you must get up at this time, go to sleep at this time. You are not sitting around all day. You are working. And we know that there is a labor force within the prison system. There is privatization of the prisons, and there is an economic benefit. So do prisoners fight fire in California? We know they do. They fight fires. Do they make all kind of furniture? Do they make parts to cars? Do they contribute to the economy of this country? We know they do. How much do they get paid? How much do prisoners get paid for doing those things? $1 an hour maybe? When they're fighting fires, maybe $2 an hour? That is the truth. If you look at that critically, you see that this is just the new slavery. How many people in our community have been put in prison because of just drugs? Many, hundreds of thousands because of drugs. How many people who use opioids that are prescribed by physicians are put in prison for opioid overdose? No, they go to rehab. They end up in the emergency room. They go to rehab. They're told that they're sick. We feel so sorry for you. We're going to help you. As opposed to being told that you're worthless, you're a criminal, having the media say the exact same thing, that this is a war that we have to overcome. It's a war on drugs, when in fact it was a war on African American men in our community. And it's a conduit between the slavery that we know and the so-called Emancipation Proclamation and what we see now. We have the largest prison population in the entire world. You may say, well, that's because we're the biggest nation. Well, of course we're not the biggest nation. But our prison population is the size of some nations and bigger than other nations.
The Prison Policy Initiative, a study backed by the Substance Abuse and Mental Health Services Administration in 2017, looked at drug use and health. A survey showed 42% of those arrested and booked 3 or more times were Black. This chart shows the numbers compared to people with no arrests. The same study found that the majority of people arrested 3 or more times reported having a substance abuse disorder. The researchers say their data shows that a significant portion of people with multiple arrests have serious mental health and medical needs, and they cannot and should not be addressed by jails. Here in Florida, these are the demographics of the inmate population in black and white. In both 2019 and 2021, data from the Florida Department of Corrections shows black men outnumbered white men. Black males made up 45% of the total prison population, 10 points higher than white males.
Jail is big business. Having people inside of there is big business. Okay, if they're paying for it from them being in private now, institutions that have become privatized, or if it is because the jails are being filled with people, which means that other people have jobs to keep them in line. So now when we're talking about why is being arrested not going to change the addiction process, I mean, what it does is it puts you in a stable environment. That means that you at that moment aren't dealing with being exposed to the easily accessibility of getting the drugs. But again, you're just talking about putting somebody away for a period of time. What goes on is needing other things to help them recognize the core of why this is going on from the beginning. What are we doing there? So yes, you have drug court. Drug court is structured. They go to drug court, they go get the papers signed, they have to do UAs. All of this is structured for X amount of time. You complete it, then you're free. But in the interim, right, when all of that's done, what is it after? What is the resources to help individuals not to come back, to change the recidivism of going back to incarceration based on drug use? So there needs to be more resources, there needs to be better education, especially in the black community, because we don't have treatment facilities that are specific to our ethnicity. Not saying that we're very different than others in terms of once we're on drugs, but there are different elements that are exposing us for the reason of getting on drugs. You know, our environments are different. We might come from households that's single family, or maybe they're both parents are there, but they're working to provide an income and a lifestyle, which then means that we're more exposed to streets versus other individuals who come to those environments seeking, thinking that this is a new way of life or the excitement or whatever it is that they're choosing to look at to come there. But our environment is different, so we need to have treatment facilities, to me, that are geared towards us. You know, specifically understanding us, why we do what we do, our households, our living environments. Therefore, I think that we would then have a better shot at not getting arrested and not getting connected into that lifestyle. And I'm probably repeating myself, but getting caught up in the drug world, you know, because we have to look at what we're exposed to.
What do we do as a medical society to fix this problem?
Dr. Juwanza Kunjufu wrote a book many years ago, and most of us have read this book, The Conspiracy to Destroy Black Boys. And it starts with depriving them of education or teaching them through cartoons, through comic books, and that was a while back, so I'm dating myself, of course, but through social media, that they are not as worthy as education as other people are. And when you tell a lie long enough, people begin to believe it. And that is what has happened to our children and to our teachers and to our administrators in schools. And so we have something that's called the IEP. And all the teachers and all the administrators in this country are aware of that. And so from that, it is designated this child will go into this classroom. And we know that when these young children are enthusiastic and happy to be in school, if they're told they can't do it, if they're told they are not able to read, and then they're not taught to read, and then they're told that they're not as good as someone else, they become discouraged and they may drop out. We know the dropout rate in Palm Beach County for African American males is very high, more than any other group. and it's by design. It is an orchestrated effort, because if you cannot make a living, it may be that you get involved in crime. And now you're a prime candidate to be a part of the incarceration of whatever that crime is. You're going to be incarcerated at a rate higher than someone else who does the same exact thing.
So some of this problem starts very early, back in second and third grade is what you're saying.
Correct. And it's not by chance, it's by design. It's an orchestrated effort to decrease the educational opportunities for African American males in this country in the public school system. And surprisingly, also in the private school system. When you think that you're paying for your child to get a better education, there are some that would not be fair to your child, even though you're paying tuition.
We went straight to State Attorney Dave Ehrenberg. He's in his third term as State Attorney for the 15th Judicial Circuit. He leads a team of 120 prosecutors and 220 staff members in 5 offices in Palm Beach County. Ehrenberg created the Sober Home Task Force to crack down and clean up the drug rehab industry. 120 arrests and about 90 convictions so far, making Palm Beach County a model for the rest of the state. We sat down with a doctor, and the doctor says some of the problem with the opioid epidemic lies in what she calls drug slavery, a systematic effort to hurt the black community, to keep them bonded to drugs. And she says whether it's a result of biased judges or through the privatization of prisons that need a labor pool, primarily black labor pool, to be a successful business. Is there drug slavery in the U.S.? I know that's a loaded question, but is there drug slavery?
Well, first, it's great to be back on with you. I have not seen any drug slavery out there as far as the term that you have used, but there is implicit bias that we all need to address in our criminal justice system, and that's something we have worked on in our office with implicit bias training. But as far as who gets diversion and who gets incarceration, we do it based on the facts of every case. If it's someone who needs treatment, that person needs to go through treatment, and if the person is a businessman who sells drugs, well, that person should go to jail. And so we try to treat the dealer different than the user. And what you're getting at, I think, is that you're suggesting that maybe judges treat different defendants differently based on race, but I have not seen that explicit bias in the criminal justice system. I have seen some implicit bias that we need to address, but I wouldn't go as far to say there is such a thing as drug slavery the way that you use the term.
So let's talk about some of the bias that you say that needs to be addressed. What are those biases?
Well, it's important that we treat drug use as a brain disease, as an addiction, and not necessarily as a moral failing. Because in the past, you saw we had different rules for crack cocaine than you do for opioids, where you have someone addicted to opioids, you want to get that person treatment, you want to get that person rehab. But when it came to crack cocaine in the 80s, it was about incarceration. It was about extremely difficult, tough sentences for people. And there was a disparity between the way crack cocaine was treated and powder cocaine. Powder cocaine was largely a white drug. Crack cocaine affected the black community in greater proportion. And so you had a different treatment of those two drugs, and that would be a case of bias. And I hope that now, in the year 2022, we've reached the stage where we treat drugs as a brain disease when you have someone who's addicted to it, and not someone who should be incarcerated for 20 years for possessing a drug. Now, it's different, though, when you're talking about a drug dealer. The person who enriches himself or herself at the expense of others needs to be incarcerated, and the criminal justice system needs, ideally, to be colorblind. But because of implicit bias, we know that we have not achieved that yet, and we're working towards it. In our office, we have repeated training so that we treat all defendants equally. But that's something that it's important to call out, to recognize, and to target.
Do you think there's bias in the courts in terms of sentencing when it comes to those struggling with addiction?
Of course there is. We know that that's a fact. We know that someone that gets busted with crack that's black and someone that gets busted with cocaine powder that's Caucasian is going to be sentenced differently. We see this every day in society, that this is a reality that's being shown to us, but what are people doing? Some people are standing up and saying, hey, we don't like this. Others are turning their head, saying they don't want to be involved. So we understand that there's a bias in the court system because the numbers say it. There are more blacks in jail, black men. So that's also a big slavery concept, because they're removing us out of the homes. They're removing structure. They're removing men out of the homes to help young men learn how to be men. Because I'm sorry, women can help a man be a good person, but they cannot teach a man how to be a man. So if you're removing all the men out of the environments, out of their homes, based on using, so we know that that has that element, that's the reason, but the bottom line is you could get locked up. Now they're changing it, marijuana laws are changing, but imagine that when you were getting locked up for having some weed and this guy's getting probation. So yeah, there's prejudice within that.
Dr. Walker, so at what point do we, I'm hearing what you're saying, at what point do we say to our own people that we need to reach for something higher? How do we do that? We know that these things are in place. So what do we do to say, hey, I know this is in place, but I'm not going to fall victim to this?
Well, look at what we have now. We know that medical marijuana, recreational marijuana, is in this country. And so in Florida, we have medical marijuana. We don't have recreational marijuana as a law yet. But you see, laws can be changed because marijuana, how many are in prison right now for marijuana? Were they released? No, they're still in prison. Why? Because it's profitable for the people who are making money off of this. What is it? It's an industrial complex. That prison is just like any other industrial complex that makes money. And so you would think, okay, now listen, marijuana is legal in so many different states. Why do we still have this mass prison population for people who sold or used marijuana? They're not getting out. Why? It's the law. We have to change the laws. We have to change the mindset of individuals and stop believing a lie, and we have to change the laws.
Do you think we still have people who are addicted to drugs still serving sentences because they were addicted to drugs and they probably should have been in treatment?
Well, here, one thing I brought in to the state attorney's office was to treat non-violent drug offenders, meaning drug possessors, as someone who needed treatment. Now, if it's someone who was selling and using, that's different. But if it's someone who is using drugs because they are addicted, that person should go to rehab. That person should be able to break that cycle of addiction, because otherwise you're going to see a revolving door in our criminal justice system. And the way to break that is to have drug courts, which is focused on rehabilitation, repeated testing rather than purely incarceration. But it's also getting tough on the career drug dealers who make a living out of exploiting others at the lowest stages of their lives. And so that's why we try to treat those two categories, the dealer and the user, differently. Are there still people who are incarcerated because of drug possession? I would think there is, but I don't believe it's for marijuana possession. It would be for something much harder than marijuana. We don't seek jail time for people who are just pure marijuana possessors. If they're trafficking in drugs, that's different. If the marijuana charge is attached to a violent crime, for example, if they're a gang member and they rob someone and they also have marijuana, we'll add that charge to it. But as far as someone sitting in our jails purely because of marijuana possession, I think that would be rare if it even occurs at all.
Yeah, I think in earlier times it was looked at as a problem. You know what I'm saying? And not a disease. So it was about, you're an addict, you're sick, there's something wrong with you, you shouldn't do that. Versus now the medical community is making sure that people are aware that this is a disease, no different than diabetes or cancer, that this happens. There's a certain element within us that once activated, based on us putting that substance in us that begins to motivate the drive to want to fulfill it. You know, so as the other week, a gentleman that was on a panel was talking about the reward system, talking about the receptors, what happens when the receptors are changed about, and wanting to get that feeling of feeling good. So now that they realize that this is a medical issue, now they're trying to provide more information to help curb this, making society aware that people don't just want to do the things they're doing, but once the drugs are within us, we have become addicted to it, and then we act accordingly to what the disease is telling us to do.
With addiction being looked at as a problem, how did that impact communities?
Good question. I think that when it was looked at as a problem, it was looked at that's their problem, that was specific to Black neighborhoods, Latin neighborhoods. It wasn't looked at over here in the white neighborhoods, you know what I'm saying, as that, because not us, that's them. So with that kind of mindset, there wasn't being involvement to go further investigation to see that this is a disease. It was basically saying they want to do this, they want to live like that, they want to be animals. So the concept and the labeling has brought the community to almost buy into that. So like, you know, well, can't you stop? Because, you know, we have the church, we have the preachers who say, let's preach you out of addiction. Let's pray for you, which prayer is the most wonderful and rewarding element that we have. But the bottom line is they have to understand that this thing sometimes can be hereditary, that it is being passed on through our genes, that no one wakes up and says, hey, I think I want to be an addict, or I want to be an alcoholic. There are some medical issues that are going on, and today they're able to begin to look at that and see that this is why it's now being called a disease versus just a problem. So I think that the society is having a different view and being more open. And I think that started to happen way back when Kennedy's son got arrested in Harlem. Here's Kennedy, prestigious family, and you have him in Harlem copying drugs. So now America is looking and saying, well, maybe this is a little bit more than what we want to say, that this isn't just their problem, this is a problem that is affecting everyone's community. So I think that's what now is beginning to happen, and that is being looked at from a medical standpoint, which is then opening up people's eyes to realize that this disease is medically also affecting us, that, you know, there's things that are going on internally that's driving that need to have it.
How much of a difference do you think it can make if addiction is looked at as a disease and treated that way?
Well, I think it's important to look at addiction as a brain disease and not as a moral failing. And I think that's something that we have come to understand using the science over the years. And that's something we have focused on with our opioid epidemic, because your brain changes once you get hooked on opioids. And people get hooked on opioids in large number because they got an injury and they were prescribed these powerful painkillers, and then they get hooked. And the next thing you know, now they're out there buying heroin on the streets. And so you have to understand that drug use, addiction, is a brain disease, and when you focus on that, then you get that person help rather than throw them in a jail cell for 20 years. But the person who takes advantage of that person, the person who is selling drugs and making money off another person's misery, they need to be treated, in my mind, harshly, because what worse person can you imagine than to make a profit off of someone's misery?
What kind of solutions do you think need to be made to help people that are locked down?
I think that there need to be more classes, education. I think there needs to be more resources that are specifically understanding that we need to have inside those facilities trained individuals who are able to recognize that people are in there because of their addiction and not just because of the crime. Because, yeah, we know that there's some people that like and are addicted to doing criminal acts That's different than someone that is going in doing the act because they've run out of money or means and ways to get what they need, so now they go and commit a crime. So if we have people that are educated, that are also experienced, because education is not going to be enough if you don't have the experience to understand what I may have been going through. So I think that's why, and this may seem biased, but I think that addicts make the best counselors because of their own problem with the disease they can recognize from a personal standpoint versus just education, which is academic. So academic means I'm understanding this from this level, but I'm not understanding it from this level. So I think that we need to have people that are in there that have been exposed and involved, more of a peer-to-peer kind of thing, to help and provide solutions based on resources, so that when people are coming out of there, they have somewhere to go versus back to the neighborhood.
What's your message to people who are locked down and locked in with addiction?
There is a way out. There is a light. And it may take a minute. Hopefully they don't have to die from what's going on, but to ask for help and to allow us to help them. I think that people, if they know that they could get the help and it's not going to cost them an arm and a leg, that they may be more apt to want to say, hey, I need the help. But when you think about the reality that it's big business, incarceration is big business, treatment is big business. So you're not finding a lot of free centers. And when you do, they are, how do we say this? They are at the minimum of things because of the resources of finances. So, the upgraded type of place that they're going to be in. Like there are places that are luxurious and people go to treatment, and it's like it changes their idea because they have now have a snapshot of a new way of living. Because think about it, if you've been using and you've been in the hood and you've been in an abandoned building getting high, right, and then they put you someplace where there's a bed and nice sheets and things of that sort, okay, you're going to think differently for the moment of comfort. So we need to maybe change something also about not making it so that 3 hots and a cot idea, but providing an ability to show a new kind of way of living that's possible.
And that's not available right now.
No, because they don't want to put the money into that. Why would they? Because that means then that people would stop going to jail. If they could change the way that these places are designed, then people would probably make a difference once they come out because they have an idea of what something better is able to be obtained. So why would they want to do that? When drugs, incarceration, treatment is all big business. It's a dollar.
It goes back to the drug slavery argument.
Yes, exactly. It's a cycle. Why would they want that to happen? It's just like, we say that going to treatment is a triage because there's but so much that you can do within the day in the focus. You have groups, you have individuals, but, some people need more time. You know what I'm saying? So when you're looking at this from the business aspect, maybe their insurance only covers X, right? So then they're not going to be able to keep them there. So they'll go out. Then maybe they can come back and get a few more days. So yeah, it's that slavery concept because they're not breaking that through saying we need to provide them as much time in the facility that is required to help them get to the core issue, to also provide ways and means for them to change their lifestyle.
What makes the experience after rehab so critical?
Presently, there are places that are called recovery centers, and they are providing the resources for individuals. And so there are a couple of them in Palm Beach County, and there's one down in Broward County that I know of. And what this is a place that has the ability to provide people with medical care information, employment information, education information, resources. So after coming out of rehab or incarceration, there's an outlet to go to help before returning right back to the same place that got you where you were, in months prior. So that's something that's going on. There's probably needed more and more recovery centers, you know what I'm saying? Because then that means that people are bringing in the resources. Then when the resources are being available to people, they get an opportunity to do a change. If I know that I'm going to get medical care because I'm afraid to go to the doctor because I don't have any money, and they're not, with the thought they're not going to take care of me. But if I have a resource that's going to help me learn how to get insurance to be covered, if I have a resource that tells me, okay, you want to go back to school, here's how we could help you do that. Or you have a trade that you're good at, okay? You may be good at carpentry, you may be good at painting, and they're saying, listen, we're going to help you develop that skill so that it can become marketable. So I think that the more places like that that are going to be developed and be attainable will help to shift in this thing that's going on, which is called addiction, because then we have a place to go to do something else with this energy. Because think about it, we have energy, and then once you come out of treatment and you don't have somewhere to put the energy, what do? You go get high.
Dr. Walker, it's a vicious cycle then. If the laws aren't changed, this continues to become a vicious cycle.
But we can orchestrate a change. We have to understand that the laws need to change and then push for it. So it's not like we're passive. We can be extremely aggressive in our efforts to speak to our lawmakers and make it happen. That's what we need to do. So as an organization, we can make it happen, and as individuals, we can have a coalition to make it happen. That's what has to happen.
The only way to fix it nationally is for Congress to act, and they won't. They don't understand the issue, or they don't have the political courage to do something about it, but they need to. The Affordable Care Act has done a lot of good for a lot of people, and it has expanded drug treatment to millions of people who otherwise couldn't get it, and that's a good thing. But the flip side of that is that you have bad actors who see these new laws as a pot of gold, and they come down and they exploit people who are in rehab to siphon away insurance proceeds from them and keep them in a perpetual state of relapse rather than recovery. And until the incentive is sobriety instead of relapse, until the financial incentives are to get people well rather than to continue this churn, then this problem will continue and people will continue to die.
The men have to be able to know that there's a way out of prison for those things that are now considered funny. And I just want to give one example. Seth Meyers, who does A Closer Look on nighttime television, said something about coughing, because he says he has asthma and he uses a little metered inhaler, takes it around with him, and he starts coughing and in the house. And his wife said, are you coughing because, if you're sick, you're going to go to a hotel because I don't want COVID here? And he said, oh, no, I was just snorting some cocaine with some NYU students. And she said, you better be telling the truth because I don't want COVID here. So it became a joke that people in other groups, other stations in life can snort cocaine and make a joke of it, never be arrested, never be questioned. Whereas if someone who is in our community said that they were using cocaine or crack or any of the controlled substances, that they would then be questioned and taken into a place where maybe they wouldn't come out of it because they would be arrested.
So we really need to work on, changing the laws, as you say, so that these men can go back home to their families.
Yes.
Good evening, everyone. Thank you guys so much for joining us, and welcome. Dr. Walker, we have lots of questions for you this evening. Let's jump right into it. Do you believe that the companies who were found responsible for the opioid epidemic were sufficiently punished for the roles they played?
Absolutely not. I think anyone who looked at the case and looked at the penalties for all the egregious crimes that were committed would say that that was less than a slap on the wrist. And there are many reasons for that, but mostly it's all about money. And I keep hearing that from the other guests. It's just the money, the money, the money. So that when we have cases, we also have judges, we have prosecutors, and again, it's the same thing, the money, the money, the money. So no, they were not treated in a way that other groups may have been treated. So it is something that I think all people who actually looked at it critically would come up with the same answer.
How is there a way for them to be punished? Do you think there's ever a way for them to be punished? Or for them to be held accountable?
That's a good question. When I look just comparatively at other groups of people in the country now that are committing many, many crimes and are not punished, are not ever questioned or indicted for crimes that are obvious to everyone else, I would say that the country is at this point so geared toward the love of money that maybe not. I'm not optimistic. I mean, we can change laws, and as we, discuss, that's what we have to do. But see, here, this is a law that was broken, went to court, and then look at the outcome. So I'm not super optimistic. Maybe I'd like to hear what other people have to say about that. But we are trying to change laws, and we can make a difference in a few people's lives. But even when the laws are changed and people are indicted, and there's a court case, it's almost like a sham. It's unfortunate, but true.
Whilst we're talking about laws, do you think a federal marijuana legislation law could pass in the near future?
I do think so. Yes, I think there are a lot of people working for that. And it just makes sense. If it's working for one part of the country, the entire country should be uniform.
What laws or protections could be implemented in order to reduce the incarceration rate of Black men for drug offenses? What do you think about that?
What laws can be changed?
Yes. What laws or protections could be implemented in order to reduce the incarceration rates of Black men for drug offenses?
Okay, so for drug offenses, let's separate. I don't even know if I can separate those who sell drugs and those who use drugs, because effectively, I'm not sure if individuals know how that works. And so you could say, I'm just a drug user, I need to go to rehab, I shouldn't go to jail. There are people, see, it's not a subject matter, it is a race matter, because there are Europeans and Asians who, and I'm saying Asians too, just because they're not Africans and they're not full of they're not a lot of them in our jails. And I'm not saying anything about the Asian population, the Hispanic population, or the European population in particular. But what I am saying is that when I look at the drug population and I see that the primary, I guess, individuals who get arrested and eventually incarcerated, and incarcerated at much longer terms than anyone else, it is a question of who are you going to select? So if we look at the question again, it's a matter of, these are the people, this is the population, this African population has been subjected to many different types of slavery. And I think the 13th Amendment says that if anyone's incarcerated, they are considered a slave. Is that right? I'm asking all the attorneys that are looking at this, tell me what the 13th Amendment really says. Does it say that that person is a slave? So I guess the question is, how can we change this? How do we change slavery in the first place? So if we look at that and say, was it economic? Part of it was, but did it actually turn out the way we wanted it? No, because then after that we had Jim Crow and we had a lot of other things, and we have the same things now. So I just want you to think it's a problem for people who want to continue to enslave African people, and then it becomes a problem for us. So I don't want to get too much off the track, but it is an issue that unless someone is committed to the truth, it will not be resolved by those same people, because they're not committed to the truth. They're not committed to do the same thing. So I'm going to ask you one more time, just quick, and I'm going to answer quick. Ask that question again, and I'll give you two succinct lines.
Okay. What laws or protections could be implemented in order to reduce the incarceration rates of Black men for drug offenses?
What laws? So we probably shouldn't have laws against users. No
Oh,
laws against anyone who is a drug user.
okay,
That should not be considered a crime.
okay, okay. I think I agree with that. Let me ask you this, Dr. Walker. Florida has secured $860 million from CVS and others to settle opioid cases. What do you think should be done with that money? 860 million, that's a lot of money. And we've got a lot of people that are addicted to opioids. What do you think they should do with that money? What do you think
Well,
the state should do with that money?
Well, I'm not sure that it's just the state that has jurisdiction over that money. I think that that some industries and some individuals and some nonprofits can petition grants for part of that money. Because certainly we do a lot of work in the area anyway, and we probably are doing the work for free. And I don't know if Mr. Rose is going to, maybe speak to that, but certainly we need help in that. As physicians, I don't know. I really have no idea how to um, get some of that and do something. We know what to do with it once we get it, but as far as petitioning for a certain amount of money, I'm not quite sure how that works.
We'll have to, I'm going to make it my mission to find out how we can do that so we can get some people the help that they need. We have another question for you, Dr. Walker. If there were more educational and financial opportunities in low-income neighborhoods, do you think these communities would be less susceptible to opioid addiction?
Yes.
And if so, why?
Absolutely. Okay, so I grew up in a little place in the south side of Chicago called Princeton Park. Right next door, anybody who's from Chicago knows what I'm talking about. Right next door to that was called Loden Homes. These are projects. This is low income housing. When I was growing up, I didn't know that, but as we look back, we see. So what types of things were poured into that community? Well, the first thing we had was pride of place and pride of person. The school that I attended for elementary school was called not George Washington, not Abraham Lincoln, not Roosevelt, not any of that. It was the Dr. Charles Richard Drew Elementary School, and there's huge picture of Dr. Drew looking. He's just very, elegant and proud, and we were always taught that he was a scholar, he was a gentleman, he was a great physician, the father of blood banking. And these little children going to kindergarten, we see this picture every day. So yes, the money can be put there, but we have to structure the money and decide how we want our community to look. And I don't have anything against George Washington Public School or Abraham Lincoln Public School or Roosevelt or any of those schools, but how about naming the schools after the people that we honor? And also, once we do that, there are resources that we can get. There are resources that are always publicized, like, oh, we're taking this to the poor community, but the same amount of money goes to another community, and it's not said, oh, this is the poor community. And I won't call any names because that's not wise. However, there are communities that get more than we get, and it's not considered subsidized. You understand what I'm saying? So the way you name something makes a difference. It makes people think, oh, well, yeah, I need government help. But these other communities are getting government help more than what we're getting, and it's not being said that way. So it makes a difference the way we look at it and what we repeat. We don't have to repeat everything they say. We make up our own style of talking about ourselves and telling our children about what's going on in our community.
We have time for like one more question here. What is the simple solution, do you think, to lowering the addiction rate in the Black population? What is the simple solution to that?
I'm not sure that there is a simple That word in itself lends itself to error. There's no simplicity there. There's just a myriad of reasons why people turn to drugs, and it's not just in a poor community, but people who are extremely wealthy who are addicted to drugs. People that are extremely educated that are addicted to drugs. People that are somewhat religious and are addicted to drugs. So it's just a compilation of a lot of different people and a lot of different reasons. So there's no simplicity there when we approach this problem at all. So it's kind of we have to understand the individual, and I agree with those individuals who were once drug users who now counsel people, because there is a certain amount of understanding, there is a certain amount of empathy, and a certain amount of wisdom that they can impart to the individual. So I don't think there's a simple answer to that at all.
Dr. Walker, I really had a good time. I enjoyed the conversation that we had. I've learned a lot from you. Thank you so much for everything that you do, and thank you for everything that you do for our community. Thanks to everybody who's on this webinar. Thank you for joining us today. We will have another opioid prevention and education series next month on June 23rd at 6 p.m. Eastern Time. And that topic is the ways in which Big Pharma incentivize addiction. And I'm also going to repeat that I talked about earlier. You can get you 1 CME or CE credit from today's webinar. And we will also choose one lucky person who is listening tonight to receive a $100 gift card by mail. So please wait until the end of this webinar to scan the QR code for your CME or your CE credit.
On behalf of our organization, we would like to thank you for electing to take this opportunity to learn. We also would like to thank our team and panelists for helping us make this project possible. If you would like more information on TD Ward Jefferson Medical Society, please visit our website at tljmedicalsociety.org.